Good afternoon, everyone. Thank you for participating in the 2015-2020 Strategic Plan webinar for First 5 LA. We will be beginning in just 1 minute. We are finalizing all of our technical pieces, so appreciate your patience. 1 more minute until we begin. Thank you. Good afternoon, everyone. Thank you for participating. We will begin today's webinar with some brief words from our Executive Director, Kim Belcher. Kim? Kim, are you there? Okay, we are still having some technical difficulties, so I will go ahead and get started since we are mindful of everyone's time. On behalf of Kim Belcher and all of our staff, yes?
I'm going to conference Kim in.
Okay, thank you. Just 1 moment, everyone. We're trying to bring our Executive Director on the line. She's calling in remotely, so please appreciate your patience. Hello? Kim?
Yeah, this is Kim.
Hi, Kim. Hi, Kim. We are live, and we're able to hear your opening words for today's webinar on the 2015-2020 Strategic Plan.
Great. Thank you so much, Jessica, and my apologies to everyone for some of our technological challenges. And I'm just delighted to welcome everyone and thank you for joining us today. And we wanted to spend a little bit of time talking about a very important milestone that our board reached last week when our Board of Commissioners approved our strategic plan for 2015-2020, focusing for the future. And we are really excited about the plan to the extent we believe it lays out a very clear path for organization with a clear focus on shared our impact related to strengthening families and improving outcomes for the greatest number of kids prenatal to age 5 in LA County possible. It really represents a very straightforward roadmap for how First 5 LA intends to be moving forward. And it's the product of quite a bit of careful listening and learning over the course of the past 12 to 15, 18 months from multiple partners and stakeholders, parents, community members, and of course our own staff and commissioners. We have endeavored throughout this planning process to be as transparent as possible about both what we have been hearing and learning about our organization and opportunities to maximize impact, as well as to share with you all steps that our commissioners have taken through this process. So today we really want to take this step further relative to sharing with you First 5 LA's renewed vision, focus, and role, and giving you an overview of what led us to the approach approved our board last week and the strategies and our plans for moving forward. And again, really appreciate the engagement of stakeholders, contractors, others throughout this process. We kicked off our planning effort last spring. The webinar, we've had multiple stakeholder surveys and input sessions, as well as community meetings for the last month. So look upon this as the next step in our shared interest, or our shared journey, I should say, together to maximize impact for young children in LA County and support their readiness for kindergarten and success in school and life. So let me turn over to Jessica, Director of Office of Strategic Planning and Implementation, to get us going. Jessica?
Great. Thank you, Kim. Before we continue with today's presentation, I just wanted to share with everyone on the call today that there will be a Q&A portion at the end of this webinar. And we have everyone on mute, so if you do have any questions, just please type them in the questions section where we will queue them up and address each of your questions in the order of, that we receive them. And that will be done at the end of the presentation. So appreciate your working with us on that point. So to begin the webinar, for more than 15 years, First 5 LA has been dedicated to serving children prenatal to age 5 and their families. As we prepared for the development of the 2015-2020 strategic plan, it was time to take a deep look at the goals of our organization, the needs of children, parents, and communities, and the effectiveness of First 5 LA's supported efforts to date. To do this, we listened to parents, community leaders, residents, elected officials, nonprofits, and our grantees. We also engaged our commission and staff. And everyone was invited to the table to share their concerns and hopes for LA County's families and communities, as well as their thoughts about how First 5 LA could be a more effective partner in our work. We looked to the following questions. What are the greatest needs of children prenatal to age 5 and their families? We also looked at what should First 5 LA's role be and how can we do our work going forward. We looked at the gaps in the systems of services that help support families and in our current work. And we also looked at how we can contribute to the most significant change. The following slides will highlight what we heard through this inquiry. First, we heard that parents must be at the center of our work, that parents and caregivers are the key to a child's development and well-being. We also heard that parents and caregivers must have the skills, knowledge, and supports they need to promote their child's development. We heard that to support parents and families, we need to promote family supporting environments because it is critical for communities and neighborhoods to have the capacity to create safe, healthy places where young children and their families can thrive. And everyone, from elected officials and teachers to business owners and neighbors, everyone participating on this call today needs to take responsibility and action to strengthen communities and the systems of services and supports, such as early care and education and health-related systems to help parents as well as improve childhood outcomes. We also got direct feedback regarding First 5 LA itself. What we heard was clear. While First 5 LA has strong support, we lacked focus. We had no clear direction or driving purpose and no guiding North Star. Our strategies were not connected or aligned to achieve meaningful, lasting change. This lack of direction was reflected in our funding, which was seen as being scattered and trying to address too many issues, and primarily supporting direct services and programs that had limited impact only to those who were participating in those programs. We were seen as trying to be all things to all people, as evidenced by our more than 50 initiatives that we were funding. In short, we heard that for First 5 LA to maximize its contribution to improving outcomes for young children, we must do a better job of focusing and clarifying our strategic direction, our role, and our intended impact. We also heard that there is an opportunity for us to be a better partner. The fact is that we are just one player in this large county that is working to improve the lives of children and their families. And so we need to find new ways to collaborate, to partner with others, and to strengthen and honor the work that is already underway. In addition to what we heard, we had to examine our fiscal reality. First 5 LA is funded by tobacco taxes, and every year fewer people are smoking. And while this is very good news, it also means that tobacco tax revenues are decreasing. In the 15 years since the passage of Proposition 10, tobacco tax revenues in First 5 LA's, which is First 5 LA's primary source of income, have decreased by 50%. Our revenues are steadily decreasing from an average of approximately $180 million annually, which we saw between 1998 and 2000, to about $90 million for the current year. Meanwhile, our expenditures have grown and our annual spending began to exceed revenue in 2009. So this means we need to be even more strategic in how we invest so we are able to live within our means. If we are to conduct business as usual and focus the majority of our spending on individual direct services, we would only be able to help a relatively small number of families and children for a limited time. And so we needed to have a new approach and a new way to focus our work in order to make the greatest impact on the lives of children in LA County and their families. So to help accomplish this, our commission established a set of principles to define what a successful strategic plan would achieve and to provide a clear direction. So these principles are that we would determine a clear, well-defined focus for First 5 LA, that this strategic plan would align our goals to the long-term financial projections and strategy, and that most importantly we would maximize the return on First 5 LA's future investments to be able to achieve the greatest possible impact for children prenatal to age 5 and their families. Our commission also identified criteria to guide how our investment decisions would be made. We would be focusing on prevention, focusing on systems and policy change, and seek to have a broad impact in the county. We would include components to strengthen families and, whenever possible, improve community capacity. We would also identify and scale evidence-based practices and engage partners in sustainability and scalability of efforts up front. Furthermore, the Commission determined we needed to be clear about the purpose of our work. And the Commission identified that purpose as being that all children in LA County would enter kindergarten ready to succeed in school and life. To do this work, it requires a more focused approach that puts parents and caregivers at the center of our work. Specifically, what we're talking about are the protective factors, which are helping parents and caregivers strengthen their skills, knowledge, and access to resources in order to support their child's development. Addressing the challenges faced by today's families is a big task, and so we know we can't do it alone. Only by working together with parents, communities, and other organizations to change policies and improve service delivery systems can we address the core issues that are preventing so many children and their families from getting the supports they need. And we also are putting a greater emphasis on policy and systems change. And so I want to provide some clarity about what we mean by that. So what does changing systems look like? It is helping organizations and communities work better together and improving how services and supports are delivered. It's also about changing people's attitudes and behaviors and putting new practices and safeguards in place to protect families. And it's also about offering better services and programs to families. And so that provides an overview of some of the important foundational pieces that the Commission began with the strategic planning process, and some important background information that helped to guide their decisions. I'm now going to turn this over to Amy Loya Owens, who is a program officer here at First 5 LA, and she will share with you some of the key components of the strategic plan.
Thank you, Jessica. These next few slides will outline the areas we will focus on and how the work will look going forward. We have identified 4 outcomes where we can achieve broad, lasting impact affecting the greatest number of children and their families. They are 1, increasing the family protective factors; 2, increasing community capacity to support and promote the safety, healthy development, and well-being of children prenatal to age 5 and their families; 3, increasing access to quality early care and education; and 4, improving capacity of health, mental health, and substance abuse services systems to meet the needs of children prenatal to age 5 and their families. So now we're going to talk through these outcomes a little bit further. The first outcome is families. We work with families so that they have the skills, knowledge, and resources needed to support their child's development. Why does this matter? Research has shown that when parents and caregivers have certain skills and supports, child outcomes improve. These skills and supports, known as protective factors, include the ability of parents and caregivers to understand how their child develops and their role in supporting that growth, their ability to manage stress, their ability to maintain healthy relationships and a circle of support of friends and family, their ability to provide positive environments for their children, and to have access to services when they need it. So what will we do? First 5 LA will continue to invest in parents at the earliest stages possible in their child's development. Through our Welcome Baby program, we will continue hospital-based support for expectant and new parents in targeted communities. Home visiting is one way to effectively build the protective factors by engaging parents and caregivers in their child's development at the earliest stages. These programs make a positive difference on a range of outcomes, including child and health development, school readiness, as well as prevention of child abuse and neglect, and increased family self-sufficiency. Through Welcome Baby, parents develop the skills needed to create a supportive home learning environment and get linked to the information and services to ensure healthy growth. Families are referred to a more intensive home visiting program for additional services and support if required. Our investments in programs and practices that help to build the protective factors for parents and caregivers will also be supported by research and advocacy investments to change policy or improve the systems that support families. We will assess the effectiveness of our home visiting programs and other parent engagement efforts to gain public and private support to create more of these types of programs and make them available to all new parents and LA County families. In addition, First 5LA will work to expand the evidence regarding what programs are effective at building the protective factors in the ECE and health-related settings. First 5LA will also conduct limited pilot testing of evidence-based parent engagement programs within ECE and/or health-related settings within the Best Start communities. The second outcome is focused on communities. We support our community's ability to foster safe, healthy, and engaged neighborhoods that help children and their families thrive. Why does this matter? Just as a child is dependent on their parents to thrive, families are stronger when they live in neighborhoods and communities that support parents and caregivers and help them be able to raise their children. Families themselves build the protective factors, but communities, from family and friends to those around the neighborhood and including service providers, give parents a sense of belonging and provide them with information, knowledge, and support to be able to be the best parents they can be. If communities create barriers or are unable to support a child's development, child outcomes are negatively impacted. Focusing on the places in which families live and building the capacity of communities can create and sustain thriving and healthy environments for all children. So what will we do within this area? First 5LA is continuing its commitment to the 14 Best Start communities. Through Best Start, we help to strengthen the capacity of these 14 communities to support families, promote parent and caregiver participation within their community, improve the coordination of the systems that serve them, and support the enhancement of the environments in which children live, learn, and play. Central to First 5LA's work in Best Start communities is our engagement of parents, residents, and local organizations to create a shared vision and action plan. This work promotes collective action to remove barriers, eliminate gaps in service, expand effective programs, and increase awareness of the resources that are available to young children and families when they need them. By actively engaging residents to collectively solve challenges, First 5LA can help communities strengthen families and neighborhoods and achieve long-lasting improvements where children can thrive. Now, we also know that families exist not only in the context of communities, but also in the systems that interact with them. The next two outcomes are focused on improving the quality, effectiveness, and coordination of the early care and education and health-related systems. Regarding early care and education, our work will focus on increasing access to affordable, quality early care and education programs such as infant and toddler care and preschool. Why does this matter? By participating in quality early care and education programs, children are more likely to have better socio-emotional skills, such as the ability to make friends, find solutions to conflict in a healthy way, and follow directions. Additionally, they are more likely to be ready for school and achieve key academic milestones, such as third-grade reading proficiency. However, in LA County, there are significant gaps and needs across the county regarding access to early care and education programs, as well as the quality of programs and workforce capacity and skills. For example, there is limited availability of quality programs for infants and toddlers, as well as preschool-age children, and this is especially prevalent among children living in low-income communities of color. Within the workforce development system, there is a need for increased alignment across qualifications, competencies, and preparation and training. So what will we do? In order to close these gaps and truly expand access to quality, affordable, and sustainable early care and education, there must be a focused effort to increase public funding in LA County. First 5LA will work with elected officials and other advocates and funders to build support for additional investment in early care and education to increase the number of affordable and sustainable child care programs and improve the quality of those programs. We will advocate at the local, state, and national levels to increase resources to improve the availability of programs for infants and toddlers as well as preschool-age children. In addition, First 5LA will collaborate with partners to develop a kindergarten readiness assessment that can help inform and drive early care and education policy as well as fiscal and systems change. To empower parental decision-making and drive program improvement, First 5LA will support a uniform system that measures the quality of early learning programs as well as improves the quality of those programs. and also provides information that parents and caregivers can use when they make decisions about their children's care. First 5LA will also work to improve professional development systems so that early care and education providers have strong skills and the knowledge necessary to help young children get ready for school. The fourth outcome area is focused on improving how health-related systems coordinate and deliver care to young children and their families. Health-related systems include health, mental health, and substance abuse services. So why does this matter? Health, mental health, and substance abuse issues can have a significant effect on the healthy development of children. Therefore, it is vital that health-related systems can timely and appropriately diagnose problems and deliver effective care that is responsive to families in need. However, navigating these systems is difficult and complicated for many, which results in families and children falling through the cracks. One of the most damaging factors in a child's development is the effects of trauma and chronic stress. Children who experience trauma such as abuse, neglect, loss, and chronic stress as a result of poverty, community and family violence, homelessness, or parental substance abuse and maternal depression often face lifelong physical and emotional health problems. We know this is an important area and we wanted to look at this going forward. So what will we do? First 5LA has identified 2 ways we can advance improvements across these health-related systems and help the greatest number of children and families. First 5LA will focus on strengthening how health-related systems connect, coordinate, and assist families in receiving early intervention services needed for their child's healthy development. Specifically, First 5LA will work to improve how systems work together to provide timely screening, effective care coordination, and appropriate referrals so that more young children at risk of developmental delays have access to the care that they need to thrive. Second, we will respond to the effects of trauma on a child's development in 2 ways. First 5LA will collaborate with experts to learn about the impact of trauma on a child's development and the gaps in service providers' abilities to respond to families affected by trauma. And 2, we will develop an action plan to build and promote the capacity of healthcare providers and systems to realize, recognize, and respond to families and their young children who have experienced trauma. First 5LA will focus its resources on 6 investment areas, which represent specific streams of work to advance the 4 outcomes just discussed. These investment areas include public policy and advocacy, research and development, service delivery system improvement, provider training, community capacity building, and communications. At the time of the plan's approval, we developed estimates across the 4 outcome areas in order to have a greater understanding of the resources needed and available to implement the work outlined in the strategic plan. It is important to note the following observations from these estimates. The programmatic outcome areas are not mutually exclusive. Investments in families and communities will yield positive effects in early care and education and health outcomes for children. Families are at the core of the work outlined in the next strategic plan, and therefore, as you can see on the slide, you see the greatest investment in that area. Projections that you see build upon the organization's implementation experience. For example, we've been implementing Welcome Baby and Best Start, which embody our Building Stronger Families framework, and we were able to use that information to develop these projections. The Commission is committed to putting its available resources to use to advance the outcomes outlined in the 2015 to 2020 strategic plan. Moreover, by the end of this strategic plan, it is expected that First 5LA's expenditures will align with revenues so that First 5LA becomes an organization that lives and operates within its means. Today we've shared with you key components of the new strategic plan. With the approval of the plan last week, we are now moving to the implementation planning phase with the goal of an implementation plan approved by the board in June 2015. During implementation planning, the following work will take place. We will conduct an additional financial analysis, which means that staff will continue to refine cost projections to implement the work in the 4 outcomes. We will also work on strategy refinement and execution, which will include further outlining the activities required to implement the strategies. We will develop an evaluation and learning plan, which will be used to measure success. We will also look at organizational alignment, which means we will examine how our capacity and structure can support this work. And finally, we'll look at some ideas around future funding models, which would include exploring other revenue sources. As we transition to our new strategic plan, we want to emphasize that First 5 LA is committed to seeing all current funding commitments through to the end of the term of the projects, consistent with the Commission-approved governance guidelines. Additionally, future contracts and grants will be considered in the context of alignment to the new strategic plan. Again, this is also consistent with our governance guidelines. We will be spending the next several months preparing for implementation of the plan. We hope to work with you, all of you here on the call, collaborating not only during the implementation planning process, but also throughout the next several years as we put into place our new strategies. Working together, we can ensure that all children enter kindergarten ready to succeed in school and life. And that concludes our presentation today. Thank you for attending today's webinar. We are now happy to take any questions that you have. Please note that all participants are on mute, so questions should be submitted through the questions section on the bottom right-hand corner of the webinar screen, and we will address them in the order that we receive them. Also, I do want to note that the presentation slides from this webinar will be available on our website. The link is shown there on the screen. On the website, you can access the full 2015 to 2020 strategic plan, as well as a document that highlights some key components of the plan, and there's also a frequently asked questions section. Soon we will also post a parent brochure about the strategic plan as well. So again, thank you for your time, and now we will begin to address questions.
Great, thank you, Amy. We do have our first question, and that is whether or not the webinar, a recording of the webinar will be available on our website. And the answer is yes. We will have this webinar available on our new website under our strategic planning page. So you will be able to access that at any point in time. We also have a question about how will our 2015-2020 strategic plan affect our grant making, and when will our next round of grants open? So this strategic plan does take effect with our 2015-2016 fiscal year, which begins on July 1st, 2015. And our grant making will be guided by the principles and strategies outlined in the strategic plan. We will be focusing our work around prevention efforts, focusing on systems and policy change, and providing an emphasis on identifying and scaling evidence-based practices. And it's a sample of what you heard today. We also will be looking at how we build out our investment areas that were also shared today, such as research and development, public policy and advocacy, and our community capacity building efforts. So our future grant making will include those principles as well as those types of funding strategies. Our next question is, how does the First 5 LA strategic plan align with the statewide goals and priorities? So this strategic plan aligns very well with the state's priorities for children in California. In doing our work, we looked at the policy and funding landscape for California, and that includes the First 5 California organization. And we were looking at ways that we could leverage the work occurring at the state level with a particular emphasis on the unique characteristics of LA County. So we definitely took that into account and included ways that we could build upon statewide efforts. Okay, the next question is, can you speak more about the trauma-informed care identification and best practices components? Our commission identified the need to respond to the effects of trauma on the child's development, and that is an area that is new for the commission. And so one of the first areas that we, or one of the first steps that we need to do is to really understand the field and the effects that trauma does have, especially on our target population, and where First 5 LA could support action and the incorporation of best practices into services and systems for young children. Our next question is, in the distribution of funds, there is a very large section labeled as Other. What does it include? So other costs do include our current administrative operations as well as our programmatic operations. It also includes estimates for our research and evaluation expenditures, and for some of our annual contracts that will continue into the next strategic planning period. So we used estimates for each of those categories of costs to provide the Commission with an overview of the full portfolio of expenses that would or could be incurred during this next 5-year period. Okay, our next question is, if passed, what impact would the proposed increase in California's tobacco tax, up to $2, have on the future funding for First 5 organizations? So an increase in the tobacco tax that is directed toward the same principles that are in the Proposition 10 mandate would definitely have a positive impact for First 5 LA, and we have been asked by our commission to look at the possibility of other funding streams and the feasibility of other funding streams to help support some of our efforts. That will be ongoing work during this implementation period that we will continue to explore. Our next question, when you refer to protective factors, are you referring to those from the Center for the Study of Social Policy, Strengthening Families approach? Yes, the answer is yes. We have been working very closely in the field of the Strengthening Families area for many years, and we have used the Center for the Study of Social Policy's Protective Factors framework as a guiding star for our work for many years, and this plan makes that work very explicit. The next question, in the distribution of funds, there is a very large, oh, I'm sorry, this one already answered. The question about the other component of the distribution of funds. This is the next one. Will First 5 LA specifically consider a public outreach or advertising campaign effort countywide to educate families about the benefits of breastfeeding? We have supported education around breastfeeding for many years as an organization. That level of specificity is something that will be explored during implementation planning period and how we can build off of our previous efforts. So I would say that that's work that staff will continue to analyze and look at during implementation planning. Next question, regarding aligning co-op efforts, does the strategic plan involve insurance carriers and behavioral health payers to manage approved services and cost containment? So are these possible capitation rates or contract or divisions of responsibilities? That is a very technical question. What I can say is that for many of our efforts, in particular our home visitation work, we are looking at ways and strategies in which we can help inform the reimbursement structures for health carriers, especially and health insurance providers, especially as it pertains to preventive services such as home visitation, in order to help provide reimbursement for those types of services, which we believe do help contain costs in the long run. What do you envision in means of building protective factors other than welcome baby, which is not universally embraced by new mothers? So we are, as part of our work in implementation planning, we will be looking at other evidence-based practices that do help to build the protective factors of families. However, we see that our work through home visitation and through the community efforts are ways in which you help to support families building their social connections, their resiliency, managing their stress, and we are looking at ways that we can explore other evidence-based practices that help increase the knowledge and the use of best practices amongst providers that really do help to build the protective factors with families. What type of effort is being done by First 5 LA to include public input and feedback with the current implementation planning? So we are actually in the process of determining the structure and process by which we will be doing implementation planning. I can say with confidence that we know there are many experts out in the field that we will want to engage with to help with our better understanding of the ways in which the activities that we've outlined can be implemented. And of course, we are interested in exploring other activities that align with the investment guidelines the board has proposed through the strategic plan that help to advance our outcomes. So we will be looking at ways that we can bring experts and stakeholders and community residents together to share their experience and their learning. Will you support evidence-informed practices to allow for new priorities to evolve? So our commission has made a commitment to supporting evidence-based practices as a priority. However, we do know that there are practices out there that are research-informed, that are promising, that may need to have additional exploration or testing to actually make them evidence-based. And so during implementation planning, we will be looking and examining those types of models and practices to see what contribution First 5 LA could make to the field in that area, with the hopes of informing greater knowledge in the field as well as informing policy and systems change. Okay. So those are the questions we've received so far. We will stay on the line for a bit more time to see if there are any additional questions that come through.
While we're waiting to see if anyone else has additional questions, we do just want to remind folks that and highly encourage you to visit the First 5LA website with some information, not only the plan itself, but additional details, frequently asked questions, and again, the webinar slides and recording will be posted there as well.
Here we do have one additional question. Has First 5LA partnered with specific academic medical institutions to support the validation of treatment outcomes? We have partnered with many different types of organizations to help inform our work. And we will continue to seek relevant partnerships. I am personally not familiar with this group, but that would be something that we would be interested in exploring. Okay, so we have not received any additional questions, so I want to thank you all for your time this afternoon. We appreciate you spending this hour with us and hearing more about the strategic plan. We do look forward to continued dialogue with all of our stakeholders, and please continue to refer back to our website for additional information and ongoing updates. We do keep that site very updated and with all of our current information. So please continue to visit that website for additional information going forward. Thank you so much for your time this afternoon, and we look forward to hearing from you again.